Hello, my name is Jaden Gillum, and today I will be performing the skill of a medication push through an IV. I would knock on the door, introduce myself to the patient, explain what's happening. I would make sure to identify my patient using 2 patient identifiers. I would make sure to observe by the 11 rights. Then I would check the medication against the MAR, observing the 3 medication checks. I would also assess the patient for any allergies to any medications. Then I'm going to come over to my patient, check their IV site for any complications, any redness, swelling, anything like that. This patient's good. So the next thing that I would do is I would perform hand hygiene, and then I would don clean gloves. Then the next thing I would do is I would make sure to pick the port that is the closest to the patient. I would stop my IV just in case. Okay, my IV is stopped. Next thing I'm going to do is take an alcohol wipe and scrub my hub. Scrub it clean, making sure and allowing it to dry for a full minute. Then I would grab my sterile saline solution. I would attach it to the IV. I would aspirate, pulling back, making sure I got good blood return, and then I would inject the flush, flushing over at least a minute, making sure to observe my IV site, making sure there's no infiltration, anything like that. Once it's flushed, I would take another alcohol wipe, scrub the hub again. Okay. Taking their medication, attaching it, and then I would also push slowly, or at whatever rate that I'm supposed to push it per orders, making sure to assess my patient's IV site for any infiltration, any edema, anything like that. Okay, push slowly. There's nothing, it's all empty. Next thing I would do is take another alcohol wipe, scrub my hub. Okay, it's done. I would take another saline flush and attach it, and then I would also push this one slow as well because there's still medication in this tube. At the same rate that I did the push the medicine, I would push this solution, making sure to assess my site along the way, making sure there's no filtration, anything like that. Okay, once that's flushed, I would take another alcohol wipe, making sure to scrub the hub again. Okay. Once that's dry, I would make sure to put my little protection clamp on it, secure it in. Then I would start my IV back, making sure to check the flow rate and that it's going at the right prescribed rate. And then I would also continue assessing my patient's IV site for any infiltration or anything like that. Okay, and they are good to go. All right, that is it. Thank you. Then I would actually make sure to document and record, and then just continue to check on my patient, making sure there's no reactions or anything like that. Thank you.